Welcome to Preop Class, where we will first be covering post-op nutrition, what to be eating and drinking after surgery. The second section will be covering the medical portion for preparing before and after surgery. If you have your program book, you can open it up to the Eating After Surgery tab. Page 44 is a good spot to start following along. Although we provide a specific timeline for the progression of the post-op diet, the ultimate goal is to find a balanced, healthy, enjoyable, and sustainable way of eating that works for you. The post-op diet progression is designed to promote healing and prevent complications. The timeline is a suggestion of the minimum amount of time. If you need to take longer, that is completely fine. Everyone is different, and it's important to listen to your body. So by now you've heard the dietitians preach protein, protein, protein at you. This is because it is very important when losing weight and plays a major role in your healing process. To calculate your current protein goal in grams, take your current weight in pounds and multiply it by 0.3. Average needs range from 60 to 100 grams a day. However, this is the average, so your needs may be lower or higher than this. Protein shakes are going to be your main source of protein for at least the first month, but many find them helpful beyond this. It's important to know that we recommend no more than 2 drinks or 60 grams of protein per day from supplements for the first 2 weeks. This is because the type of protein in these supplements is very concentrated, which can cause upset stomach and digestive issues. Protein supplements include pre-made protein drinks, protein powders, protein soups, protein jello, etc. Hopefully by now you've found a protein supplement with 20 to 30 grams of protein and less than 15 grams of carbohydrates per serving. If not, refer to pages 55 and 56 for some suggestions. This is an overview of the post-op diet progression. You can refer to this on page 44 of your program book. You can expect the post-op diet to last a total of at least 6 weeks. Again, keep in mind it is perfectly fine if it lasts longer for you. We will get into details in a minute, but here's an overview of what to expect. The first diet phase, weeks 1 and 2, is thin liquids only. Phase 2, weeks 3 and 4, is pureed foods. Phase 3, weeks 5 and 6, is soft foods. After these 3 phases, in weeks 7 to 12, you will begin to progress to normal textures again. Remember to go slow and chew foods well. In all 3 phases, the goal is a total of 64 ounces of fluids a day. In phase 3, you will likely start to move towards more structured eating, and we recommend that you separate your foods and fluids by 30 minutes before and after you eat. Remember, weeks 1 and 2 will be thin liquids only, meaning no chunks or lumps. You can refer to this on page 45. Here's a list of liquids that are safe to try. Protein shakes. If protein shakes are tasting too sweet, which is common post-op, you may have better luck making your own using a protein powder mixed with milk or non-dairy milk. If you're using non-dairy milk, pay close attention to carbohydrates on the food label. Choose the unsweetened option. Plain or flavored yogurt with no fruit or chunks. Look at the food label for protein and carbs. Try to choose one that has at least 10 grams of protein and less than 15 grams of carbs. Soups without lumps or chunks, for example tomato soup, you can boost the protein by making it with milk or adding protein powder or dry milk, or even plain yogurt. Other liquids you can try are bone broth, vegetable juice such as V8 juice, but avoid all fruit juices as they have too much sugar. Herbal tea, sugar-free jello, there are specialty brands that make protein jellos such as ProSource. Sugar-free popsicles, sugar-free flavored water, and protein water such as Premier, Isosource, or Protein 2O. The goal during this phase is 1 ounce of fluid every 15 minutes, and every other ounce should be water. Again, the goal is a total of 64 ounces of fluids per day. It can be helpful to use a fluid tracker sheet and set alarms throughout the day to keep you on track. Here are some ideas that you can try. Undri is a brand that makes protein supplements. Shown here is an unflavored protein powder and a chicken soup protein powder. Both are great savory options if you're tired of sweet protein drinks. They can be found online on Unjury's website. Protein 2O is a protein water sold at grocery stores such as Safeway, Albertsons, Walmart, Target, Amazon, and Rite Aid. They are now making a protein water with electrolytes as well. ProSource makes a protein jello that can be found on their website and on Amazon. If you're tired of plain water, Hint and True Lemon are other options as they do not have sugar. Both brands have many different flavors and can be found at most major grocery stores. At some stores, True Lemon may be found near the spices. A few yogurts that are high in protein and lower in carbs are Yoplait YQ, Chobani Less Sugar Added Greek Yogurt, and Dannon Wacos 000. Fairlife milk is an ultra-filtered milk that is lactose-free and higher in protein, lower in carbs compared to regular milk. This is carried at most major grocery stores. Thin soup such as this tomato soup is another savory option. Bone broth is another great savory option because it's much higher in protein compared to chicken or beef broth. To help you achieve your fluid goal for the day, try using a fluid tracker sheet such as the one shown here. You will receive a sheet in the hospital and can ask for a copy to bring home. You can also try fluid tracking apps such as the ones listed here. Phase 2, weeks 3 and 4 will be pureed consistency, meaning texture of cottage cheese. You can refer to this on page 46. If the food doesn't already come in that texture, then you must run it through a blender or food processor. Avoid raw vegetables, vegetables or fruit with skin or seeds, sweets, breads, pasta, and rice, even if they can be made into a pureed texture. These are very difficult for patients to tolerate for a while post-op. Here are some pureed food ideas. Refried beans with a little melted cheese, blended salsa, remember no seeds, and light sour cream, or even plain yogurt for a boost of protein. Canned tuna or chicken mixed with a little mayo or plain yogurt and blended relish. Canned chicken mixed with barbecue sauce. Pay attention to the sugar in this and only use a small amount. Egg salad, or any kind of egg besides scrambled. Make sure they are moist. Cottage cheese with pureed peaches or pears, tofu, mashed avocado and hummus, cauliflower and mashed potatoes. Although technically regular mashed potatoes are pureed texture, they're not a protein food. So again, keep in mind to prioritize protein as you will fill up quicker. Chili put through a blender, cream of wheat or oatmeal. Make sure to make these with a lot of liquid so they stay soft and moist. Sugar-free pudding and yogurt. This time it can have fruit, but still avoid skin and seeds. Phase 3, weeks 5 and 6, is soft foods. You can refer to this on page 47. We'll go over a brief overview of this phase, and you will be able to discuss this in more detail with your dietitian at your 3-week post-op visit. Soft foods mean foods that are moist and easy to chew and swallow. You no longer need to blend them. For example, you can have chicken, ideally that has been boiled, or made in the crock pot or Instapot so that it retains moisture versus baking it or grilling it. It's important to take small bites, chew food well, and take your time. During this phase, you still need to avoid bread, pasta, rice, dry meat, raw vegetables, vegetables or fruit with skin or seeds, and sugary foods or drinks such as fruit juice. These are some guidelines to keep in mind during the first month post-op. Stay well hydrated, drink slowly, and increase total fluids to the goal of 64 ounces a day. Drink frequently throughout the day. Keep your water bottle everywhere with you, and set alarms on your phone if needed. Remember to avoid carbonated drinks. This includes sparkling waters. Avoid caffeine and drinks with sugar in them. Remember, protein is always important, especially right after surgery as you're healing. Again, you will need a protein supplement for at least the first month. It can be helpful to track your protein intake using any of the listed websites or apps, or even just pen and paper. Refer to page 54 of your book for protein content of various foods. Don't forget to start a chewable or liquid multivitamin after surgery for the first month post-op. Remember, no gummies. Here's a picture of what your meal tray will look like after surgery. The hospital will provide protein supplements. However, if you have a specialty one that you want to use, please make sure to bring it with you. Keep in mind that too much sugar or fat at once can lead to slower weight loss and can cause dumping syndrome. Dumping syndrome is when you overload your much smaller stomach with sugar and or fat, and it can no longer break those down or digest them like it used to. The sugar and fat are then dumped into your intestines, which causes pain and symptoms such as cramping, diarrhea, nausea, vomiting, shaking, or sweating. Avoid alcohol for at least 3 months post-op, as it can irritate your stomach and delay healing. Remember, you will feel the effects much more easily after surgery. Plus, it's a source of empty calories, which can slow weight loss. Avoid caffeine for the first month post-op, as it may irritate your stomach. If you decide to drink it after that, keep in mind if you drink too much, it can decrease absorption of certain vitamins and minerals. In order to feel your best, set yourself up for success by making a plan. Gradually work on eating 3 small meals and 1 to 2 planned snacks consistently throughout the day. Try using small plates, bowls, and utensils to help with portion control. Smaller utensils can also help you slow down when eating. Remember to eat protein first every time you eat. Focus on choosing lean protein and increasing soft vegetables as tolerated. Don't forget to take your vitamin supplements every day for the rest of your life. Additional vitamins and minerals will be added at your 3-week post-op visit. Labs for vitamin and mineral levels will be drawn at your 3-month post-op visit. It's important to eat slow and chew all foods well. Pay attention to early signs of fullness and stop eating at the first sign. For the first few months, average meal sizes are around a 1/4 cup to 1/2 cup. But remember, everyone is different, so if you're eating more or less than this, don't stress. Just be sure to listen to your body. After surgery, you will still have weight loss plateaus. When this happens, remember to focus on everything you've learned throughout this process. Pay attention to hunger and fullness cues, prioritize lean protein and vegetables, and incorporate movement if you can. You can also schedule with the team as often as you would like for additional support. The goals of following up with your dietitian are to help you learn how to meet your nutrient needs, as well as learning how to manage cravings, food desires, hunger, and disease states. It is helpful for the dietitians if you keep a food record of everything you eat and drink for at least 3 to 4 days before your appointment. Remember, you've come a long way already. This is not an easy process, but always remember that you are worth it.
Thank you, Katie, and all of the Legacy dietitians who specialize in bariatric surgery, and for your expertise and amazing support. Please be sure to reach out to any one of them if you need anything at all. By now, you should be close to or have your surgery date scheduled. This is an exciting time. We ask that this video be reviewed prior to your one-on-one pre-op visit with your medical provider, and write down any questions you may have. In the second part of this video, we will review what to expect before and after your weight loss surgery. We will review why to call after surgery and review possible complications. As we look at what to expect from this moment moving forward, we need you to have your labs drawn at least 4 weeks prior to your surgery date. Additional information will be provided to you to assist in scheduling a time with a lab so you do not have to wait. We will prescribe medications for you to take after your weight loss surgery. We will try to have these medications available for you to pick up prior to your surgery so that you will be well prepared when you get home. Let's review these. Your surgeon recommends taking an antacid twice daily for 3 months following surgery to help reduce the amount of gastric acid and reduce the risk of an ulcer. Pepcid is also called famotidine and is the most common antacid we prescribe. The second prescription that you will be provided is to take after your weight loss surgery is a medication to help treat nausea. The most common medication we prescribe is Zofran. This medication is to be taken just as needed. The third medication all patients will be prescribed is for pain. The most common medication prescribed is oxycodone. This medication is a narcotic and works well to treat abdominal pain that you may experience after weight loss surgery. There are many other things we can do to treat pain that will be encouraged and will be discussed in more detail shortly. The last prescription we are going to discuss may or may not be prescribed to you based on your own risk factors. Lovenox is a blood thinner. This is to be taken after surgery until the prescription is completed. The hospital nurse will show you how to use this. Just a friendly reminder that our clinic only refills medications during normal business hours. Please allow 3 business days for refills. There are many different ways we can treat pain. Our goal is to encourage the treatments with the lowest side effects first. When treatment options are combined, they work very well. Our goal is to treat your pain with the lowest dose of narcotics for the shortest duration. Alternating between ice and heat can help alleviate surgical pain. Tylenol is a medication that works very well to treat pain and has very few side effects. As long as you have no contraindications to taking this medication, you can take 1,000 milligrams every 6 hours for a max dose of 4,000 milligrams daily. Try taking this before you take any pain medications. If you are still uncomfortable, then add the narcotic pain medication. This slide pertains only to patients who are undergoing a sleeve gastrectomy. Celebrex may be prescribed to you and is to be taken as needed. Try this before taking a narcotic pain medication. If you are still uncomfortable, then add the narcotic. You will receive a narcotic pain medication that is to be used for severe post-surgical pain. If the other strategies to treat pain are not adequate, then this medication is indicated. Do not take more than prescribed, as this can cause problems breathing, leading to death. Increased risk of addiction can occur the longer used. We have a safe medication disposal box available at our pharmacy on the first floor. Please bring any leftover pain medications to your post-op visit for a safe disposal. Other medications that may be helpful include a stool softener. This medication helps prevent constipation. Other medications to treat constipation include Dulcolax suppository or Fleet's enemas. Don't hesitate to contact us with any concerns with constipation. Gas-X can be helpful for bloating, discomfort, or gas pains. So let's move forward to the day before surgery. The hospital will call you the day before surgery to notify you of your arrival time. The day before surgery, we ask that you be on a full liquid diet 24 hours prior to surgery. We ask that the day before surgery, to prevent any post-op infections, you take a shower the night before, washing with soap. We also ask that you have no food or drink after midnight the day before surgery. Moving ahead to the day of surgery. The morning of surgery, take only the medications that were recommended by your doctor with sips of water. Cleansing wipes will be provided to you at your one-on-one visit along with directions, and we ask that you use these wipes just before leaving for the hospital. This is one more way we can prevent infections. And don't forget to bring your CPAP with you to the hospital. The morning of surgery, you will be asked to check in at the hospital at a specific time. Please give yourself plenty of time to park. We have free parking for all patients and their visitors. The parking structure that is easiest to access the hospital is parking structure 2. Enter through the front of the hospital and someone from our admissions team will check you in and introduce you to the nurse who will prepare you for surgery. You will meet with a surgeon prior to surgery, so know that you will have plenty of time to ask any last-minute questions. Now, I would like to share with you a short 1-minute video reviewing the gastric bypass surgery.
To gain access to the abdominal cavity, small incisions are created on the abdomen. Trocars, which serve as passageways for the surgical instruments, are placed into the incisions. The surgeon examines the abdominal cavity using a laparoscope or video camera. A small stomach pouch is created using a stapling device. This smaller stomach pouch restricts the amount of food that can be eaten before feeling full. The small intestine is separated into 2 sections. The lower portion of the small intestine is attached to the newly created stomach pouch. This allows food to pass directly into the small intestine, where digestion continues. Bypassing a portion of the small intestine decreases the absorption of calories and nutrients. The upper portion of the small intestine is reconnected to the lower portion of the intestine. The bile and pancreatic fluids from the liver and pancreas allow food to be completely digested.
We have a second video reviewing the sleeve gastrectomy.
The sleeve gastrectomy is a restrictive procedure, which limits the amount of food you can eat by reducing the size of your stomach. To gain access to the abdominal cavity, small incisions are created on the abdomen. Trocars, which serve as passageways for the surgical instruments, are placed into the incisions. Surgical instruments are passed through the trocars to access the abdominal cavity. The surgeon examines the abdomen using a laparoscope or video camera. The average human stomach can expand to hold around 1 to 1.5 liters of food. While in the stomach, food is combined with digestive enzymes to help break down the food into a more simple form, so that it can be more easily digested and absorbed once in the small bowel. During a sleeve gastrectomy, a thin vertical sleeve is created by using a stapling device. This sleeve will typically hold between 50 to 150 milliliters, or is about the size of a banana. The excised portion of the stomach is removed. The newly created gastric sleeve is able to hold approximately 1/10 of what the stomach was able to hold before. This smaller stomach sleeve restricts the amount of food you can eat before feeling full. The bile and pancreatic fluids from the liver and pancreas mix with the food and allow it to be completely digested and absorbed in the bowel. There is no rerouting of the small bowel or post-operative adjustments necessary for the sleeve gastrectomy.
Now that we have reviewed the gastric bypass and sleeve gastrectomy videos, I'd like to move forward to what you will expect upon waking from surgery. You will find that you will have your own bariatric suite, and a typical stay in the hospital is 1 night. You will see a similar pain scale that will be used after surgery to communicate with your nurse how you rate your pain at that moment, starting with a 0 representing no pain and a 10 representing the worst pain possible. We encourage walking after surgery to help breathing and prevent blood clots. This device is an incentive spirometer and is used to encourage or incentivize you to focus on deep breathing. Deep breathing helps prevent pneumonia. We ask that you sit up with your feet on the floor when drinking. This helps prevent from aspiration, which can lead to a pneumonia. Your fluid goals will be focusing on approximately 1 ounce of fluid every 15 minutes, or slower if that is not tolerated. Please be sure to take the initiative to use your CPAP while in the hospital and at home. Your surgeon will see you the morning after your surgery and assess how you are doing. As long as you are ready to go, they will fill out your discharge paperwork. Each of your medications will be reviewed by your surgical team, and it will indicate whether you are to continue or not. Do not take any medications except the ones listed on your discharge paperwork. When asked what size pill can I take after my bariatric surgery, we believe it is okay to take any pill that fits inside a chapstick cap. Pills larger than this should be cut into smaller pieces. Your discharge paperwork will also include your physical restrictions. Avoid lifting more than 15 pounds for 1 month after surgery. Avoid driving until off all pain medications. There will be multiple small incisions on your abdomen that are covered with surgical glue. It is okay to shower after surgery, but please don't remove the skin glue as this acts as a band-aid. Please refrain from bathing or getting into a hot tub for 2 weeks. And the last item we are going to discuss is related to alcohol. Alcohol blood levels can be 2 to 4 times higher after bariatric surgery, and we do not want anybody to drive even after 1 drink. Your first visit to check in with your surgeon will be at approximately 3 weeks after your surgery date, or sooner if needed. This concludes our discussion on what to expect after you have been discharged home. If you have any further questions regarding what your hospital experience may look like, please write them down and discuss them at your one-on-one meeting or reach out to us sooner. Now we will transition to learning more about when to call your surgeon. When to call, reviewing possible complications. This information is to help you understand what signs and symptoms are concerning and important to share with your surgeon. We will review post-op complications. As you know, these are rare. They are intended to provide you with a brief overview of what to look for. Remember, you do not need to know what the diagnosis is, but just reaching out to our team allows us to investigate further. One key message we want to get across is that earlier we learn something, the earlier we can intervene. Please call if you have any concerns. So let's start with a few of the early post-op complications that can occur. Let's remember, the incidence of these are low, but not zero, so this is why we're reviewing the signs, what signs to look for. The first being a staple line leak. The incidence is 1 to 4%, and fever and rapid heart rate is what I want you to remember. The typical timeline for a presentation is anywhere up to 10 days for a gastric bypass and even longer for a sleeve. It is important to follow the dietary recommendations so that you do not place extra stress on your healing staple lines. Another early post-op complication that is important to identify early is bleeding. What you need to know is that vomiting blood, maroon or bloody stools are never normal after surgery. Low blood pressure is a vital sign that we will be monitoring. Should anyone call in with chest pain or shortness of breath, we will have you evaluated at the emergency room to rule out a heart attack. All patients are at risk. The incidence is 1 to 2%. People present with chest pain. Any surgery increases a person's risk for developing a blood clot, and weight loss surgery is no different. Blood circulation can slow and lead to clotting. We use leg squeezers in the hospital to keep the blood circulating from your calves. We encourage early walking and prescribe a blood thinner to all patients in the hospital. Patients are at the highest risk for developing blood clots the first month after surgery. Signs to pay attention to include one leg that is swollen, red, and may be painful. This needs to be evaluated further. If a clot presents in the lung, we may see shortness of breath or a sense of anxiety. early detection is important. Another post-op complication is a wound infection. This often presents in the larger incision. The incidence is anywhere from 1 to 4%. This may require IV antibiotics. You've heard the dietitian reminding you to keep sipping after surgery to stay well hydrated. Dehydration results and can be presented if you have low urine output. Dehydration is also exacerbated by vomiting, diarrhea, and extreme heat. Continue sipping. If you feel that you are not able to catch up on your fluid needs, call our office and we may need to get fluids through an IV. Dumping syndrome after gastric bypass surgery is when food gets dumped directly from your stomach into the small intestines without being digested, especially sugar. The small intestine cannot tolerate this, and any one of these symptoms can present. These include the desire to lie down, heart racing, feeling tired, faint, passing out, sweaty, headache, flushing, diarrhea, nausea, fullness, abdominal cramping, or even your stomach growling. Most people with dumping syndrome develop signs and symptoms 10 to 30 minutes after eating. Others have symptoms 1 to 3 hours after eating. Generally, you can help prevent dumping syndrome by changing your diet after surgery. Changes might include eating smaller meals and limiting high sugar foods. The next complication we are going to review is an incisional hernia. A hernia is any opening in the abdominal wall, in this case would be located near your incision. The incision doesn't heal properly inside, and the muscles can separate and internal structures may protrude or herniate out the abdominal wall. This would present as a bulge. If pain and vomiting is not present, this is not an emergency. A small bowel obstruction, the incidence is 1 to 3% after bypass. It presents with abdominal pain and vomiting, and these patients need to be referred to the bariatric surgeon as soon as possible. An ulcer is a sore that develops in the inner lining of your stomach. They can develop regardless of weight loss surgery, but people who undergo bariatric surgery may face an increased risk of developing an ulcer. The incidence is anywhere from 10 to 15% over many years. We do routine H. pylori screening and treatment to help prevent ulcers. Rarely these require reoperation. They present with epigastric pain and vomiting. We will evaluate with an EGD, and the treatment is a proton pump inhibitor. And the last post-op complication we are going to review is a gallstone formation. Rapid weight loss leads to the creation of gallstones. Your surgeon will prescribe you a medication at your first post-op visit. And the way that this medication works is that it helps break down the stones during this rapid weight loss phase. This medication does very little to pre-existing stones, so you may still be at risk for having irritation of the gallbladder stones. Signs you would look for include intermittent right upper abdominal pain or epigastric pain, typically after eating and often associated with nausea. So that concludes a review of our post-op complications. And I want to circle back to our main point discussed earlier in this talk. Earlier intervention leads to better outcomes, so call early. Know we are here for you. Just to review our contact information, we have a bariatric surgeon on call at all times, and someone will get back to you any time of day. You can reach someone on our team by calling the number listed. After hours, we have an answering service that will take your contact information and connect you with someone on our team. Any questions? I recommend writing these down and bringing them to your one-on-one medical visit to discuss further, or you're welcome to contact our office. I want to thank you for taking the time and reviewing this very important information. We look forward to supporting you through your weight loss journey.